Hello, this is Dr. Grande. Today's question is, do individuals with avoidant personality disorder respond differently to fear in others? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about avoidant personality disorder, we're talking about a construct that's fairly similar to social anxiety disorder. And we know from the research that social anxiety disorder has this relationship with fear in other individuals, meaning individuals with social anxiety disorder tend to avoid fearful expressions in other people. So this question is really asking, is that the same for avoidant personality disorder? Now, there's not a lot of research published on avoidant personality disorder, but there was a study published in 2011 by Rosenthal and colleagues that looked at avoidant personality disorder and all of the facial expressions to see if there were any differences between individuals who had avoidant personality disorder and those that didn't. So first, let's take a look at avoidant personality disorder. What are the symptoms that we would see associated with this disorder? Well, we know from the Diagnostic and Statistical Manual, the DSM, that there are 7 symptoms in the symptom criteria. We see avoiding occupational activities where there is significant interpersonal contact because of a fear of criticism, disapproval, or rejection. We see an unwillingness to form friendships unless there's a certainty of being liked, trouble with intimate relationships, and this is because of fear of shame, a preoccupation with criticism or rejection in social situations, being inhibited with new relationships, and this is because of fear of inadequacy, feelings of being inept or inferior, and also a reluctance to take risks because of a fear of being embarrassed. So we see a lot of themes here with avoidant personality disorder: fear of rejection, disapproval, criticism, feeling inadequate, inept, inferior, and being ashamed or embarrassed. So we can see how avoidant personality disorder could really cause difficulties in a lot of different areas of somebody's life. Now, there's a theory as far as some of the interpersonal problems we see with mental disorders, including personality disorders, that there's this impaired ability to recognize facial expressions. And that's what we're really talking about here with avoidant personality disorder and fearful expressions. We see research on social anxiety disorder, which is similar to avoidant personality disorder, and I mentioned those findings before. There is an avoidance of fearful faces there, but we also see difficulties recognizing facial expressions in general with antisocial personality disorder, and the research is mixed around borderline personality disorder, but generally we do see some differences in facial recognition abilities and tendencies in borderline personality disorder. So to understand how this study and other studies like it function, it's first important to understand the prototypical facial expressions. We know there are 6, and these have been found to be facial expressions that are recognized across cultures. So we have sadness, happiness, anger, fear, surprise, and disgust. Those are the 6 facial expressions. So oftentimes when researchers hypothesize that there's going to be some sort of impairment with facial recognition, they use these 6 facial expressions, even if they really think that only one might be statistically significantly different. So it's fairly common for the tests of facial recognition to include all 6 of the facial expressions. Now, in this particular study, a specific instrument was used to evaluate how accurately somebody recognized facial expressions, and it's called the Multimorph Facial Affect Recognition Task. And really, it's a fairly clever type of instrument. Here we see an individual is given the list of those 6 facial expressions, and they're shown an image of a neutral face. And that neutral face gradually moves through stages to what's called 100% expression. So one of those 6 facial expressions at 100%. So it should be easily recognizable for most people. So it moves from neutral, which is 0%, to that full expression, 100%, in 39 stages. So it's quite gradual. So it really looks at 2 different factors. Sensitivity, we can also think of this as speed, and this is the average number of stages it takes to correctly identify that facial expression, and accuracy. And accuracy is only measured at that 100% expression, at that full expression. So at the end, the participant is given an opportunity to choose their final answer in terms of what emotion they're seeing on the screen. So the finding in this study was that individuals with avoidant personality disorder were less accurate in identifying fear at that 100% expression level. But there was no difference between individuals with avoidant personality disorder and those that do not have the personality disorder with any of the other 5 facial expressions. Also, even with fear included, there was no difference with speed, that sensitivity measure. So really, there weren't many differences found at all. It was just this one difference with this full expression of fear with avoidant personality disorder. So these results are consistent with other results we've seen from other studies with social anxiety disorder, but it's inconsistent with some other studies on social anxiety disorder. There are other studies that show that there's no difference across any of the facial expressions. So we don't really have agreement in terms of social anxiety disorder and avoidant personality disorder and facial expressions, including the facial expression of fear. So what can we learn from this study about avoidant personality disorder? Well, there's different theories as to why this finding occurred. But one theory would be that individuals with avoidant personality disorder regulate emotional arousal by directing attention away from faces that have a fearful expression. So they attempt to avoid looking at fearful expressions, and because they do this, their ability to recognize fearful expressions is impaired. Another key takeaway from this study, in my opinion, is the relationship between social anxiety disorder and avoidant personality disorder in the research. We see quite a bit of research on social anxiety disorder. We don't see much at all on avoidant personality disorder. And I think the reason for this is because a lot of researchers conceptualize these two disorders as being similar, if not the same thing. So maybe slightly different expressions of the same underlying disorder. Therefore, with research done in social anxiety disorder, inferences can be drawn to avoidant personality disorder. So I think one thing that needs to happen in the research is to really try to figure out if avoidant personality disorder truly is a separate, distinct construct from social anxiety disorder. And if it is, to conduct more research on avoidant personality disorder specifically. Of course, one of the difficulties is it's very hard to find a sample size large enough using individuals who have avoidant personality disorder. So studying avoidant personality disorder is difficult, and with these small sample sizes, and there was a small sample size in this study as well, we have to be careful about interpreting the results. I hope you found this description of avoidant personality disorder and fearful facial expressions to be interesting. Thanks for watching.